Hello, I'm Dr. Zenobia Harris, Executive Director of the Arkansas Birthing Project. Today we want to talk about a really important subject, adverse childhood experiences, or really bad things that happen to people when they're children. Today I have with me Octavia, and Octavia is going to be asking me a series of questions.
Hi, Dr. Harris. My first question is, what is adverse childhood experiences?
Well, adverse childhood experiences are things that happen to children that are traumatic or really bad when they're children. And it can have a lifelong effect upon their health status and on their life outcomes. And potentially it can lead to early death.
What are some of those traumatic events?
Some of the things that are traumatic that cause ACEs are being exposed to abuse, physical abuse, mental abuse, psychological abuse, having your caregiver, your mom, physically abused, living in the household with people who are alcoholics or drug abusers, people who have been imprisoned, and people who have psychiatric disorders.
What are some of the effects from adverse childhood experiences?
Children affected by adverse childhood experiences often engage in risk behaviors. They have chronic health conditions, and they have low life potential and experience early death.
How are females affected by adverse childhood experiences?
That's a really good question, Octavia. And it's one of the reasons why the Birthing Project exists. The Birthing Project helps to affect the adverse childhood experiences that women experience, because women who are exposed to adverse childhood experiences are more likely to suffer from or have a teenage pregnancy, more likely to be unemployed, and more likely to have serious health consequences as a result of experiencing adverse childhood experiences.
What are the concerns with teenage pregnancies?
Well, research has shown that many young women who experience teenage pregnancy don't complete their education. They may be more likely to have a baby die or have infant mortality occur. They are more likely to have a lot of health issues, and they're less likely to have current employment.
How does adverse childhood experiences affect our society?
Well, the Center for Disease Control has found that people who experience adverse childhood experiences are likely to die 20 years earlier than they normally might have died had they not experienced them. We spend over $124 million attending to the after effects of adverse childhood experiences in child maltreatment cases.
What are some of the individual risk factors?
Some of the individual risk factors are, of course, in small children and children that have chronic medical conditions. They're more likely to suffer from adverse childhood experiences because of all the demands that are placed upon their caregivers.
Are there any protective factors against adverse childhood experiences?
Fortunately, yes, there are. There are many things that can be done to try to undo or affect the changes that adverse childhood experiences can cause in a person's life. It's very important that people have social supports. That's one of the reasons, again, why the Birthing Project exists, to provide additional social supports to people who may be stressed or experiencing adverse childhood experiences. Some important things to remember are that it's good for persons to have social supports, an adequate place to live, adequate nutrition, and an income that sustains their well-being.
How can we overcome adverse childhood experiences?
Adverse childhood experiences can be overcome in many ways. One of the most important things that we have to encourage is that people develop resilience, which is the ability to overcome bad things. How this happens is by ensuring that people have, again, social supports, adequate food and clothing, a safe, healthy place to live, receive adequate education, have adequate employment, and are able to take care of the overall well-being of their families and themselves. We can all join in the fight to improve children's resilience and therefore address ACEs, or adverse childhood experiences. It's important that children feel a sense of connection, support, and love. We can all do those things for children and our families. Adverse childhood experiences can be overcome. It is important that all of us work together to make sure that our children have happy, supportive lives, that they feel loved and wanted, and that we provide them with the basics: food, clothing, shelter, and protection against harm. It's important for our children to develop a sense of resilience and to be raised by and supported by resilient adults. For more information, look at www.cdc.gov. Thanks.